Millions of people take medication every day for acid reflux or heartburn, and many of them have been on it for years. In most cases, no one has ever explained what these drugs do beyond the stomach, or what current research suggests they may be doing to the brain. Proton pump inhibitors, sold under brand names such as Losec, Prilosec, Nexium, Proton, and Pariet, are among the most commonly prescribed medications worldwide. For short-term use, they are effective and medically appropriate. The concern begins when they are taken every day for a long time, especially when their effects may reach far beyond the digestive system. As part of its normal daily activity, the brain produces toxic waste proteins. One of the most studied is amyloid, the same protein that builds up in the brains of people with Alzheimer's disease. Under healthy conditions, the brain has built-in systems that constantly clear this protein away. When those systems stop working properly, amyloid can gradually accumulate. The first of these clearance systems involves specialized immune cells that move through brain tissue, identify amyloid, and break it down inside tiny internal compartments. These compartments require a highly acidic environment to function properly, as that acidity activates the enzymes that degrade the protein. Proton pump inhibitors work by blocking acid pumps in the stomach lining. The problem is that the brain's immune cells depend on the same type of acid pump to maintain those internal compartments. Research has shown that proton pump inhibitors can cross the blood-brain barrier and interfere with these pumps in the brain as well. When that happens, those compartments become less acidic, and the cells become less effective at breaking down amyloid. They may still capture the protein, but they cannot destroy it as efficiently. Over months and years of daily use, this can mean a steady weakening of one of the brain's main waste clearance systems. There is also a second clearance system that becomes active during sleep. During deep sleep, fluid moves through the brain along channels beside the blood vessels, collecting amyloid and other waste proteins that build up during the day and carrying them out of the brain. This process is believed to be up to 80 to 90% more active during deep sleep than when we are awake. It is the brain's main overnight cleanup cycle, and it depends on consistently reaching and maintaining deep sleep. Long-term use of proton pump inhibitors has been linked to sleep disturbance, including insomnia and poorer sleep quality. When deep sleep is repeatedly disrupted, this overnight cleanup process becomes incomplete. Waste that would normally be removed is left behind, adding to the problem already created by the first mechanism. This is where the concern becomes more serious. These are not two separate issues. They affect the same problem from two different angles. The first reduces the brain's ability to break down amyloid during the day. The second reduces its ability to wash that waste out during the night. When both are happening at the same time, the brain is falling behind in clearance in two ways. Either effect on its own may not cause measurable harm in the short term, but over years of daily use, the combined strain on these systems should not be dismissed. A third pathway involves vitamin B12. Stomach acid is needed to release B12 from the protein in food so the body can absorb it. When gastric acid is suppressed, B12 absorption gradually falls. B12 is essential for healthy brain and nerve function. It helps maintain the structure of nerve fibers and supports several processes related to cognitive health. When B12 levels drop, homocysteine levels can rise. At high concentrations, homocysteine is toxic to brain tissue and has been linked to cognitive decline. One large case control study found a 65% higher risk of B12 deficiency in patients who had been taking proton pump inhibitors for 2 years or more. There is a fourth concern that gets less attention, but it is clearly documented in the medical literature. Magnesium. Long-term use of these medications has been associated with low magnesium levels in the blood, a problem serious enough that health authorities in countries such as the United States and the United Kingdom require it to be listed as a known risk on the drug label. Magnesium plays an important role in nerve signaling and in regulating several neurological processes. It also affects sleep quality. Low magnesium has been independently linked to disrupted sleep patterns, suggesting this side effect may be contributing to the sleep problems already described and worsening them. This interaction between magnesium deficiency and poor sleep may help explain why some people taking these drugs find that their sleep does not improve even when other possible causes are addressed. A fifth pathway is discussed less often, but it has attracted growing research interest in recent years. The gut and the brain are in constant two-way communication through nerve pathways, signaling molecules, and microbial activity. The microorganisms living in the digestive tract are active participants in this relationship. They produce compounds that can influence mood, inflammation, and brain function. Stomach acid is part of the body's natural defense system, helping determine which microorganisms thrive and which do not. When acid suppression continues for months or years, the balance of that microbial community changes. Strains that would normally struggle to survive in a more acidic environment may begin to establish themselves. Researchers are still studying what this means for brain function, but the link between gut microbial balance and neurological health is now one of the most active areas of research. Several compounds produced by a healthy gut microbial population, including certain short-chain fatty acids, are known to help maintain the integrity of the blood-brain barrier and regulate brain inflammation. When the microbes that produce those compounds are disrupted, those protective effects may weaken. It is important to be precise about what the evidence does and does not prove. A direct causal link between proton pump inhibitor use and dementia has not been confirmed in controlled human trials. The evidence discussed here comes from preclinical models, observational studies, and documented biological mechanisms. Some large reviews have found no significant association between these medications and dementia across the general population. Research is ongoing, and findings remain mixed across studies and patient groups. What does remain consistent in the literature is this: the biological mechanisms described are real and documented. These drugs do reach the brain. They do act on the same type of acid pump found in the brain's waste-clearing cells. They have been associated with sleep disruption, B12 depletion, magnesium loss, and changes in the gut microbial balance, which may have downstream effects on brain health. And in many cases, they are taken for long periods without any current clinical reason to continue. Studies suggest that somewhere between 25 and 70% of proton pump inhibitor prescriptions may no longer have a valid reason for continuation. That is a wide range, and methods differ from study to study. But even the lower end suggests a very large number of people are taking a medication indefinitely that was originally meant for short-term use. It is also important to understand how easily long-term use can happen without anyone planning it. These drugs are often prescribed for a specific period, commonly 4 to 8 weeks, depending on the condition being treated. But the follow-up conversation about stopping them often does not happen with the same consistency as the original prescription. Repeat prescriptions get issued. Patients keep taking the medication because it helps, because no one has advised them to stop, and because stopping suddenly can trigger a temporary but significant increase in acid production that may feel worse than the original problem. This rebound effect is itself a recognized consequence of prolonged use, and it leaves many people stuck in a cycle that was never meant to become permanent. There is one more point worth considering. These medications are also sold without a prescription in many countries for short-term symptom relief. In those cases, the packaging usually recommends a maximum of 2 weeks of use, but in practice, many people buy them again and again, which can turn into long-term daily use without any medical supervision. There may be no pharmacist review, no periodic reassessment, and no discussion about any of the mechanisms mentioned here. For those patients, the gap between intended use and actual use may be even greater. For anyone taking Losec, Prilosec, Nexium, Proton, Pariet, or an equivalent medication every day over an extended period, the right next step is to speak with a doctor about whether continued use is still necessary. Any change should happen under medical supervision, because stopping abruptly can cause a temporary but significant rebound in stomach acid, sometimes worse than the original symptoms. Long-term prescriptions should be reviewed periodically, yet for many patients, that review never happens. The brain's waste clearance systems operate continuously and rely on conditions that some medications, when used indefinitely, may gradually interfere with. Whether that risk is relevant to a particular person is something best discussed with their doctor. If you found this information helpful, share it with someone who takes this kind of medication and subscribe to more evidence-based health content.